Today I'm going to discuss a very important topic, that is your baby's feeding. Hello, I am Dr. Nishant Agarwal. I have been working as a pediatrician and a neonatologist for the past 12 years. For the first few days, your whole life revolves around the feeding of your baby. It causes so much anxiety, and rightly so. It's very normal to actually be concerned about this. So I'm going to discuss a few important topics about this which you should look into and you should be aware of. So the first question which comes to your mind is, how often do you feed your baby? Newborn babies, at least in the first days, feed very frequently, and it causes anxiety to both the parents. Why? Because the stomach is very small. Just to give you a context, the size of the stomach is less than that of a size of the walnut. So they have to be feeding for every 2 to 3 hourly. Because of the small stomach, they get emptied very fast and they need feed every 2 to 3 hourly. And these feeds have to be kept both day and nights. So a total of around 8 to 12 feeds have to be given to your baby in the first few days of life. And this is very normal and this is very okay. If you are feeling that your baby has just fed and again asking for feeding, this is very normal. How to count feeding times? The parents get confused when to start counting from, when to not start counting from. Not to keep it confusing, just by example, I'm going to tell you that if you start feeding by 10 a.m., your feed is finished by 10:30 or 10:45, you will go on to feed the baby till next 12 to 12:30. This interval is around 2 to 3 hours. This is one concept which has come up, that we can do time-based feeding, and I actually favor this concept in the first week or so. But after that, you can switch to cue-based feeding. So what is cue-based feeding? It is also called responsive feeding. So what is it? Basically, when your baby is hungry, he will give off some behavioral tics or behavioral responses which you have to identify and then feed the baby before the baby starts crying. Sometimes after 1 month or 2 months, when your baby is older, he might not feed every 2 hourly or 3 hourly, and he might require a bit more time, and that is also okay. So in that time, you can go to cue-based feeding after the first month of life. So what are these cues? How to identify them? So there are many cues in the babies. You can just Google it and find out what are the cues. But just to inform you about the most common cues, which is, there are early cues, there are mid cues, and there are late cues. So what are early cues? Early cues means that your baby is hungry and ready for feed. So these are stirring of the mouth, opening of the mouth, or turning his head towards the breast. So these are the early cues, just to give you some examples. So what are the mid cues? Mid cues are physical movement. Your baby has started stretching, your baby is putting his hand in mouth. So these are the mid cues. It means your baby is really hungry. So what are the late cues? Late cues means, I am really hungry and now I am upset. So the baby will start crying, he'll become agitated and he'll become red with anger. And at this time, you cannot feed your baby. You have to let him cry out for the next 10 or 15 minutes and then feed your baby. So just try to find out what are your baby's early cues and mid cues, and your feeding will become very easy. Another important thing that I want to talk about is cluster feeding. What is cluster feeding? Is basically your baby feeds every hourly or half hourly and you are fed up. So this is very okay. Sometimes a baby feeds in bursts and he might feed even 2 to 3 times in a 2-hour time. This is very okay. And cluster feeding is very common, especially in the evening or when your baby in a growth spurt. It does not mean that your milk is becoming insufficient or there is a problem. This is very normal and it is a part of a newborn life and your baby is going through it. So don't worry and don't get into stress. Another question which comes to your mind and is very important is, how do I know my baby is getting enough? So it is very important. So the thing which actually gives context to it is the weight of your baby. You have to check the weight of your baby, but don't check your weight of your baby on the scale which are commercially available. Why am I saying so? These scales have error of around plus minus 200 grams. This 200 grams is very normal for you, but not for your baby. 200 grams weight loss or weight gain can cause anxiety or happiness in your family. So don't go for weight gain. Go to your pediatrician or go to your nearby clinic. They have actually accurate scales which also have an error of plus minus 50 grams, but it will be more accurate and you will be able to know the weight of your baby more accurately and the gain also more accurately. So you will ask me, then how do I know that my baby is getting enough feeds? So the only thing that you can actually monitor is the amount of urine passed by your baby. That is how much diapers he is getting wet. Normally what I say to most of the mothers who come to me is, from 8 a.m. to 8 a.m. next day, your baby should have passed 8 times urine. That is the most accurate thing that you can go. The second thing you can go for is, after taking feeds, your baby is going to sleep for 1 or 2 hours. So sometimes your baby might not go for sleep for 1 to 2 hours, but the amount of urine passed is accurate. And if the baby passes urine around 8 times in a day, 24 hours hours time, it is very good because your baby does not get any water source. Your water source is only the breast milk. So if he is passing urine, he is getting good amount of water. That means he is getting good amount of feed. So just measure how many times he is passing urine. Feeding a newborn can be exhausting and overwhelming at first. You feel that you are only feeding the baby or you are only cleaning up his diapers. You don't have to worry about it. You are doing it right. This is an experience, and for that it takes time, patience and practice. Thank you. For any queries, please write down in the comment section or you can reach us on our number.